I've spoken to a family of an elderly man just in the last couple of days who went to a GP with a respiratory illness. And when he got to the GP's centre, looked for an appointment with the doctor, and they told him to come back in January. Yesterday, I spoke to a 79-year-old woman who has an infection. She rang the GP. They told her to come back in January as well. She rang last night the doctor on call. There was no answer in the doctor on call for the hour and a half. She waited on the line. And she's spent all day in bed today because there's nothing else she can do. I spoke to a person in Beliver there last week who, again, rang North East Doctor on Call, which is regularly not staffed because of the unavailability of doctors currently there. She was told to go to Castleblaney, 89 kilometres away in heavy frost and heavy fog if she wants to get to a doctor on call. On Thursday night last, the paediatric A&E in Drogheda told parents and children that it was so stuffed in there that they needed to wait in their cars. And some of those children had to go to sleep while waiting in the A&E in their cars, again, in that really cold night. The previous Saturday, Drogheda A&E became a long-term car park for 11 ambulances who waited for 5 hours to deposit their patient there because there was no bed, chair or trolley available for them in that A&E. So we have a situation where in our particular region we have a major crisis going on in terms of capacity. Because of those ambulances being tied up, we had no ambulances being available in Cavan and Monaghan for an extended period on that night. We know that in the general sense November has been the worst month on record, 100,000 people waiting on trolleys so far this year. And this does lead to death. There is a clear correlation between long-term waiting in A&Es and delayed diagnosis, delayed treatments and deaths. And it's estimated that 360 people are dying in this state in terms of their waiting times in A&Es currently. Workers are leaving the sector. There's no doubt about it that the pressure that's been put on workers' shoulders are forcing them to leave the sector, which is a vicious circle, because it means that those who are left have a worse time in their working conditions and therefore are more likely to leave. We know there's 700 missing consultants within the health system, 897,000 people on hospital waiting lists, and 105,000 adverse incidents in the HSE last year. These are people who have been damaged, who have been made ill, in some cases been made disabled, and in some cases have lost their lives due to adverse incidents within the HSE. And in 5 years, €2 billion has been spent in relation to people taking cases against for negligence claims. So this is a significant problem. Not all of it is obviously the responsibility of this current regime, and not all of it is the full direct responsibility of the Minister. There's a cumulative effect here. A significant problem of this has actually been the cutbacks after the crash in 2008-2010, which significantly corroded the level of resource that was there in the hospital system. Another point of this is that there's about 600 medically discharged patients currently in the hospitals today. These are patients who are fit to leave the hospital, to go on to a step-down system or to go and have a carer look after them, but because they're not available, they're stuck in the hospitals. Now, I just put a PQ into you recently to find out how much the state is paying per hour for these carers, and the PQ said on average, the carers are getting €27 from the state per hour. Now, the average wage, if you look on the internet, for a carer currently in the state is €12.95, which is less than half that money, which I have to ask you, is the system working properly? Now, just in relation to all of this, and I've spoken to you in depth, there's a crisis in Meath at the moment, a particular crisis, but now that has rippled out to take on the whole region. And as a result, on Monday, there was protests outside Navan, Drogheda, Cavan, Mullingar, Ennis, Limerick and Nina. And now we have the development of a national hospital campaign who is trying to raise the profile of what's happening in the health service due to this particular crisis. Unless there is proper investment, unless there's a halt called to the HSE management who are proceeding with their plans to reduce capacity in what is a capacity crisis, Minister, well, then we're going to see this system get worse. And the only way to increase capacity, in my view, is to invest properly in the the hospitals who can actually look after patients in terms of A&E. And that means more consultant cover in the likes of Navan. €10 million a year, Minister, will actually provide for the consultant cover necessary in the likes of Navan to be able to provide for proper, safe A&E cover in that area. 10 million, that's all it will cost. And I think actually we're in a situation now where the HSE itself is becoming more isolated. 17 consultants in Drogheda signing a letter to say that the HSE actions are a threat to health. We have 4 consultants in Mullingar signing a letter to say the same. Hundreds of doctors in Meath, nurses and medics have signed a petition looking for the government to stop the process of closing down Navan A&E. The management in the HSE are becoming more isolated. I would encourage you, I would urge you, Minister, to stand up to those managers within the HSE, to stop them in their tracks and protect the health service where it counts.